Hello, Makare. Hello, doston. Hello, friends. This is Dr. Prakash here. I'm glad to meet you all once again in this channel. I want second opinion. Every day, every week, we come out with some health interesting topics. Today, we have got Mr. Raghu here. He's a clinical pharmacologist. And we are welcome, Raghu. How are you?
I'm good, Raj. How are you? I'm
I'm fantastic.
very glad to be part of this platform, and I'm very grateful to make some improvement in the community for this. Thank you for
Thank
getting me
you.
on board.
Your insights would definitely help our community better. Now, today we got an interesting topic, a controversial topic about flu jab to the community. Let's jump straight into the topic, Raghu. Now, can you explain the importance of getting a flu jab? Is it overhyped or overrated, or is it mandatory? And what is your advice on that?
So the flu jabs these days are actually undermined, and in my opinion, flu jabs should be taken because the virus these days is actually mutated so in a varied way that most of the regular treatments are actually not being sufficient. So
Right.
there's always a saying, which is prevention is better than cure. So within the same statement, I want to actually bring in the idea of actually having a flu jab as well. So
Yeah.
flu jab is nothing but it is actually your body is being prepared for these viruses that are actually going to come into into the surroundings during the course of the flu season, especially from September to March. So those are the core periods where people will be affected with coughs. It usually happens when the season changes, and
Yeah.
then obviously, as you know, as people would probably actually understand, flu is easily one of the easily spread diseases.
Exactly.
A droplet, when a person sneezes, it can actually go up to nearly 2 meters wide
Mm,
when
mm,
a person sneezes.
mm.
So if that person is actually infecting people around him around a radius of 1 or 2 meters wide, then it is an easily infected virus.
Now, this flu jab, is it what kind of a jab is it? Is it an active? Is it a dead virus or is it an antigen or what is it essentially?
So it is not an active virus. It is an inactivated virus.
Okay.
So basically, what happens is so with the World Health Organization and other data collection organizations, what they do is actually they do surveillance throughout the whole year of collecting what kind of strains have been affected throughout the entire world.
Okay.
So when they actually discuss all these and collect this data collectively, what they have to they come up with four strains. Three to
Okay.
four strains are the most common strains
Common
that's been
sense.
affected throughout the entire world.
Right.
And then each year, a flu jab will be varied from the previous year.
Okay.
So the
All right.
strains, yeah,
So it's not the same flu vaccine we give each year. All right.
no,
Okay.
no,
Okay.
that
That's why it's
that is,
important.
yeah, that's right. So that is why it is important to actually renew your flu jab every year.
Right.
So they grow the flu virus in the egg as a common practice, and then
Okay.
once it's actually inactivated, they add other adjuvants to it as well, so that
Right.
when a body is being given this vaccine, so the body kind of actually creates that antibodies,
Right.
so
That's
you're
right.
kind of actually prepared for that virus to attack you. But even
Sure.
that virus attacks you, you don't actually feel or you don't get any of those heavier symptoms. So it
Right.
just comes in as a normal cold and cough, and then that goes off.
Lovely.
But for people who don't have the vaccine and who have actually been affected by this flu virus,
Yeah.
the symptoms are really severe.
Coming to the community side,
Mm.
I'm sure there should be a lot of misconceptions or myths about this flu vaccine.
Mm.
Have you seen any? And if there are anything at all, how do you address them in a way in which our people understand this so that they take it?
I think the myths are about one of the common myths I've actually come across is basically saying that why am I needing to take this injection? If my body is well and good, why am I needing to take this injection?
Mm,
Like I actually said in the first statement has said, prevention is better than cure.
Sure.
So if you have had the jab, your
Mm,
body is kind of actually prepared for that immunity, and you're
exactly.
kind of, yeah, you are prepared for it, so that even the virus attacks you, there isn't actually a great amount of infection happening within that
Mm,
person. And one
yeah.
of the other myths is also to say that this is an active virus.
Oh, yes.
Yes.
Mm,
So, like I was actually saying, how the flu jab is actually made, it
yeah.
is not an active virus. So let us say if a flu person is actually affected, let us
Mm,
say the power of the virus is 10,000. In
yeah.
common terms, I'm kind of actually making it simple so that people can understand this. The
Yeah.
amount of virus is being taken into actually making a vaccine is 1/10, as in like 1% of the
Okay.
10,000. If you're looking at the power of the virus, you're only taking 1% of the
Okay.
virus to make the vaccine.
Right. Okay. All right.
So it is not powerful so that it'll affect you. And the other
Yeah.
myth that people actually have as well is, after getting the flu jab, I'm going to get flu.
Oh, yes. Yeah. 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 I've heard that. That's right. Yeah.
Yes. So that is not right, because the percentage or the amount of flu virus that you're actually getting in the vaccine is really negligible.
Okay.
And
All right.
because it is being negligible, your body is going to make antibodies to it. When the body makes antibodies, then even if you're affected with the virus, you don't feel any symptoms. That's the
Sure.
benefit of actually having the flu jabs.
Fantastic. Fantastic. Thanks for explaining that, Abhijit. Now, uh, do you give this flu jab to all the population in the world, or is that we need to be specific about which target population that we are going to give the flu jab to?
So there are different types of flu jabs available. So
Okay.
one can be actually squirted directly into the nostrils, and
Okay.
then yes, so that's the preparation which is usually preferred in children, because
Right.
rather than actually sticking a needle into somebody.
So, until what age in the children age group do you give this flu vaccine?
Usually, so usually we kind of actually that all depends on the licensing as well. So
Okay.
because these licenses are actually, the flu jabs are actually licensed from 6 months onwards.
Wow. Okay.
So anybody who is actually above 6 months and above
Yeah.
should actually can have the injection, or can
Right.
can have the flu jab.
Okay.
Because of the pain symptoms and so on, we kind of actually prefer for children to have the nasal flu jab,
Okay.
which is more or less like a squirt. It just comes into, you squirt it into the nostrils, and then the blood
Okay.
vessels around your nostrils take the vaccine, and then your body kind of actually make that happen as if you're actually injecting somebody.
And the elderly age group, there is no restriction or anything at all. We can give to anybody. Yeah.
There's no restrictions. There's no restrictions to the age at all after 6 months and above. Yeah.
Oh, okay. Now, how often should an individual get flu shot? And are there any variations based on the age or health conditions of the patient?
That's a very good question, Raj. So, the important thing that I want to actually get the message across to community today is, if people have got underlying health conditions, in other words, like diabetes, or long-term kidney problems, or long-term health conditions, they should be the first people, or first cohort should actually get those medication, or
Ah,
get the
all
flu
right.
jab for definite,
Okay.
because
Okay.
by default their immune systems are actually down.
Okay.
When I say down, they're actually, when you compare a healthy person who doesn't have any health conditions to a person
Hmm.
who's got other health conditions, they're
Hmm.
more prone to get infections than the other
Okay.
people.
Sure.
And
Sure.
it is preferred once a year. Like I was
Okay.
actually saying to you, during the course of the year, it goes on from September to March onwards. So
Okay.
ideally from September onwards,
Okay.
people need to actually get injections.
All right. Okay. Once they have the injection, when does the immunity start? Like insurance cover, does it start immediately or does it take a few days to work?
I, I mean, the data shows that it takes about 14 days
Right. Okay. Right.
for a good amount of cover to happen.
Sure. Okay.
Yes. And then some people, I've also noticed in some of the clinics that we've done, that some people do get some symptoms. They might
Okay.
actually have some of the symptoms that people have, especially for injection flu jabs. Their arms are actually painful, or the sight of the, yeah, that is a common factor because
Hmm.
it's an injection and because it's an adjuvated injection that we're actually giving intramuscular. The
Yeah.
pain is going to be inevitable, and
Okay.
some people may have slight temperatures as well.
Okay.
And if, yeah, and if people have slight temperature, all they need to take some is actually paracetamol or
Okay.
ibuprofen, just to
Okay.
actually reduce the temperature. And
Okay.
once, within 3 or 4 days, all of these temporary symptoms will be gone.
Right. Okay. Now, if we are going to get this flu jab done, what is the percentage of a chance where we may be getting a flu despite the flu jab? Is there any specific percentage or anything at all that you are
Again,
aware of?
like I said, because every, I mean, there isn't actually a percentage specified to this, but I can answer
Okay.
your question in a different way, in a way
Yeah.
so that, like I was actually saying to you, this viruses actually mutate so
Oh,
quickly.
yes. Okay. Hmm.
So what I mean to say is, so obviously World Health Organization and other governing bodies come up with these four different strains.
Hmm.
And if the virus mutates other than these strains, it's not
Hmm.
to say that their symptoms are going to be really bad, but
Okay.
equally they
Hmm.
might be bad because of that mutation.
Right. Okay. All right. Okay. Now, once this injection is given, how long does the immunity last in the body? Is it an everlasting immunity, or is it going to be for a specific period of time?
So it stays in the body for about a year.
Right.
That's why
Okay.
really that's why World Health Organization prefer flu jabs to be
Once a
given
year.
every
Right.
year. Yes.
All right. Now, one last question before we finish our talk: is there is any particular group of people who we should not be giving the vaccine to, or who should not be having the vaccine at all?
Especially kids of less than 6 months old.
Okay.
Yes, and the other people, the other, yes, one other group I would actually like to mention as well is whoever is actually allergic to eggs.
Okay.
Yes, because like I was actually saying, how the vaccines are made.
Yeah.
If they're allergic to eggs, it just means that they might be allergic to the flu vaccine as well.
Or because it is grown in the, yeah, in the egg. All right. What about
Correct.
the pregnancy related, and what about the patient on steroids or people with low immunity? These kind of people.
They
Uh,
can they can definitely have the flu jab.
all right. Okay.
Yes.
Okay. So it's a passive. Okay. Right. Okay.
Yes, because it's not an active. Because it is not an active virus. Because it's
Okay.
an inactivated virus. That's why they can have it.
So it's better have it. It's just a small jab, not
Yes,
much of risks, not much of complications. Not.
correct,
It's better to have it done and get it done, dusted, and get along.
correct.
Raghu, that is fantastic. Thanks a lot for your insights. We really appreciate your you sharing your knowledge, being an expertise in this particular field. I look forward to meeting you in many other topics of interest in pharmacology department. Many, many thanks, Raghu.
Thank you so much, Raj, and I feel privileged to be part of this. Thank you.